والله يدعو إلى دار السلام ويهدي من يشاء إلى صراط مستقيم.
Okay, let's take this question here from Sister Aisha from Bahrain. One of our friends, she's had 2 children already. She's going to have a 3rd child. The question is that while having this child, there's going to be some males, doctors or assistants in the actual room while it takes place. She lives in Bahrain. She wants your advice, Sheikh.
First of all, I would like to express my delight, my joy and happiness that the awareness of the fact that there is awrah, even during giving birth, is increasing amongst the Muslim Ummah. Alhamdulillah wa shukrulillah. And I would like also to explain that you have to be aware of your rights. You do have rights as patient. I do remember one day when my wife was giving birth in the States, and this is a non-Muslim country. And you know, it's difficult to say, no, I insist I need a female doctor or I need a female nurse because this is a hospital. You may have your own physician or doctor, but with the nurses, with the delivery team, with the operating room, it's kind of difficult. Yet, I found out that you do have rights as a patient, and you can request whatever. You can even request a translator. You can request a special meal. You can request this and this and that. And all of our requests were honored. That's a fact. I have to admit it on air. And so if you are in a Muslim country that's more worthy to be delivered, that you can ask for a female doctor. Many sisters call and say, is it okay to work as an engineer, as a construction engineer? We need more of anesthesiologists, females, gynecologists, mainly females. I don't understand why the number of gynecologists of men is outnumbering the women. It's supposed to be the other way around. It's supposed to be that every gynecologist is a female, because this is awra mughallada, which should be uncovered due to necessity and by a woman, not by a man. So, number one, you have to insist on requesting a female team to deliver your wife, or you yourself, if you're taking care of this, you have to request a female and a female nurse and an anesthesiologist if it is possible. What if it is not possible? In this case, we'll consider it as a darura. And الضرورة تقدر بقدرها. Each necessity will be measured according to its conditions. We do not generalize the ruling. What if there is no anesthesiologist whatsoever? What if there is, in some cases they said that, well, the case is very complicated, and the best person with this regard is a male doctor. Or otherwise there is a very high risk of the death of either, God forbid, the mother or the fetus or whatever. In this condition, we go to the alternative, which is whatever is available that suits the condition and takes care of it, only in this condition. We do not generalize the ruling, because as I said, الضرورة تقدر بقدرها. But we should not go one step ahead before taking care of, or at least trying to find out if this step is available or not. So do your best. Try to inquire a female doctor to deliver, and a female nurse and a female anesthesiologist. If it is not available at all in this condition, you can go for the alternative, which is the male. And that's prohibited, except during this necessity.
Jazakallah khair, Sheikh, for that clarification.